Hello. Today we're going to discuss career paths in EM operations and administration. This particular presentation is geared towards those of you that have already started a career in operations and may have already completed a fellowship. For the purposes of this talk, we assume that you are past the fellowship process, but may still be considering certificate programs or courses, or even an advanced degree. There are a number of certificate programs that you may want to consider. A few of them are listed here, and depending on your level of experience when you're entering your career in operations and what you feel would help you, these may be some things to consider. With regards to advanced degrees, if you have one, that's great. If you do not, you may want to consider whether it will add value to the work that you are doing. They are labor intensive, but some of these can be done on a part-time basis, and it may help round out your education and give you extra tools that you may not already possess. There are a number of advanced degrees that you can pursue, as listed here. The MPH and the MBA are the most common ones, but there are a number of newer degrees that have come online in recent years that may be better targeted towards the job that you will be doing. Do you need these for a career in operations and administration? It depends. It depends who you ask, and it depends what you want to do, but you should certainly consider it if you do not have an advanced degree and you have the time and resources to engage in one. So your career path. One thing that you have to figure out for yourself is, what is your goal? And are you planning on rising through emergency medicine strictly? Are you looking at the hospital as a path for advancement? Or, which is less viable with regards to ED operations and administration, is the medical school a viable path as well? You should figure out what your other life goals are and what will compete with the time that you have to dedicate to work. And you should always have contingency plans in case your first plan does not work. As you are working in an academic institution, you also need to figure out what role academics will play in your career. A lot of people that do operations and administration, even at academic centers, wind up getting consumed by the daily needs of the role and have little time to dedicate to their academic advancement and research productivity. For you to be successful in that regard, you must plan ahead and have clear goals as to what it is you want with regards to research and academic promotion. Remember, at an academic medical center, academic promotion may be essential for you to be eligible for certain roles at the institution. So again, what are your priorities? Do you have a career plan? Very importantly, does this plan take into account the rest of your life? Spouse, children, hobbies, other interests that you have, other goals that you have, and do you have contingency plans? Do you have a plan for what you're going to do if your initial plan doesn't work out? So we have all seen these Venn diagrams. Think about this as things that you like to do, things that you're good at doing, and things that people will pay you money to do. Ideally, there is some overlap between these three things. The more overlap there is, the more options you will have available at your institution. The less overlap there is, the more you will struggle. If you find yourself somewhere where there is zero overlap between these three things, that may be an indication that it's time to find a new job or to grow your skill set. So as we mentioned before, If you have a career in ED operations and administration, this lends itself to a wide variety of positions across the institution. There's medical directors for disaster management, there's medical directors for your transfer and access center, for network development, for telemedicine. You can become a chief at one of your community sites, you can become the chair of your academic site, you can be an associate CMO or a chief medical officer, chief operating officer, and even CEO of an institution. But any of these positions will require you to put in a lot of time, planning, and effort to be successful at them. Time management will be a very important role that you have to figure out if you have an active role in either operations or QA. If you have an active role in these areas, work will expand to fill all of your available time, and now will overwhelm next. What I mean by that is that if you do not plan ahead and carve out some time for long-range goals, you will spend all your time putting out fires and will not be able to do the bigger, bolder, more important work that you are envisioning. With regards to time management, I suggest that you designate and carve out time for long-term goals. As much as you can, try to have some degree of regularity to your clinical schedule. This will allow you to carve out days for clinical work and days for administrative work. You should also try to fit in time for your academic pursuits and dedicate either one half day or one full day to a day where you limit or eliminate meetings so you can actually get work done. Anytime you have a meeting, you do not solve work for the most part, you just create more work. So if you do not dedicate some blocks of time to actually advancing the work that you have to do, you will start falling behind. And very importantly, in your schedule, be sure to account for non-work life. You have to eat, you have to sleep, your family has to see you. All these things are very important if you want to have a long career. With regards to research, you need to figure out what your goals are. Do you want to just publish the bare minimum to keep your chairman happy? Are you interested in having an academic career with a robust research production? Are you interested in getting external grant funding? The amount of commitment that these three goals will require will be very different, and knowing ahead what it is that you want will be very important. One thing I will say about operations, it lends itself to research because operations, if done correctly, is essentially a bunch of before and after studies. And as such, if you gather the data before an intervention correctly, you have already done the bulk of the work. Now all that remains is doing the data analysis, which you have to do if you really want to know if your intervention worked, and then the part that we all fall short on, which is actually putting a manuscript together and submitting it. But if you're at an academic institution, you have a number of people that should be interested in research and people that you can mentor for research, including residents and fellows, and they may have a little bit more time to do some of the manuscript writing that you may not have time for. If you have enough of a team, it would be useful, if you're interested in research productivity, to designate a research person that is as much as possible insulated from the day-to-day requirements of administrative work. The fewer meetings and direct operational responsibility that this person has, the more time they can dedicate for your longer range goals to achieve both research productivity and longer term improvements in your emergency department. And as you graduate fellows, residents, and colleagues go to other places, you should slowly develop a network of collaborators which will increase your reach and increase the type of research and endeavors that you can engage in. One last thing I will say, it is your career. You should listen to what other people suggest, but you have to decide what is best for you. There is not infinite time, so everything that you choose to do is a trade-off. You will be giving up time to do something else, so you should decide for yourself what type of career you want to have, and then go forward in that way. When you encounter problems, focus on what you can control and plan for your next steps. Remember, if you're indispensable in your position, you cannot be promoted. So you should be training your replacement for a number of reasons. One, because it is part of mentoring the next group of people that are coming up behind you, but also because it is important to you to have the ability to be able to quickly move to a new opportunity without creating issues in your department that may prevent people from thinking of you as a viable candidate. Good luck with your career.